Anyways, what came through my news feed really, it was about a mother who miscarried. And, you know, whenever I read that about that, you know, it breaks my heart to see somebody, you know, miscarry a child. But the story was of a lady, she lived in Europe, and she actually miscarried a child after putting on 42 pounds. And it was from a misdiagnosed thyroid condition missed by her GP. And a few of the things, her name is Sunny. She ran a fitness boot camp, and in 8 months' time, she put on 42 pounds. So if any of you that are watching this that are frustrated with weight gain and have no explanation for it, you deserve some answers, number one. Number two, the most common reason for weight gain is due to fluid retention or hormone dysregulation, and that can include the thyroid. So for this lady, Sunny is her name, she begged doctors over 2 years to help her, and they really weren't listening. Because what I'm about to share with you, she was suffering from insomnia, sleep issues. She hurt all over the place, had muscle aches and pains, joint aches, and was just tired. She was wiped out. And that's probably one of the most common symptoms of thyroid problems is tired all the time, fatigue, beyond just, hey, I don't feel like doing much. It literally wipes you out. I've had a lot of women suggest to me that, you know, they would rather have broken their arm because people can look at them and see that they have a problem. Versus, you know, it's almost like a silent diagnosis that, you know, a lot of people looking at you, you look fine. So that's one of the frustrations, again, with a lot of women that have thyroid problems. Now, with this lady I'm talking about, Sunny, her GP actually told her, and this is in quotes, and I'm reading it right here on my screen in front of me, no fat people came out of the concentration camps. So, I mean, right away, her doctor's not even listening to her, pretty much dismaying everything that she's saying. And I'm sure a lot of you have been told that, you know, something similar, where you're asking questions and doctors don't like that. And it's unfortunate because you deserve answers, number one. And, you know, maybe it's past the 10-minute allotment that they give you, which is another, you know, ridiculous thing that we have to deal with within the insurance model, which is one of the reasons I opted out of that several years ago, to treat people with respect and give them the time that they need to get the care and help that they need. So Sunny actually, again, had a miscarriage because she was not, you know, her thyroid problem wasn't addressed. A simple test could have told her that. And she was eventually diagnosed with Graves, which is an autoimmune condition. And I get a lot of emails from people saying, well, you talked about hypothyroidism, you talked about Hashimoto's, but you never talk about Graves. Well, pay attention because I'll talk a little bit about Graves. Number one, it has a common thread, Graves does, just like Hashimoto's thyroid. They're both autoimmune conditions. So what does that really mean, autoimmune? It means that your immune system is attacking normal, healthy thyroid tissue in this case. And there's several, I mean, there's hundreds and thousands of different autoimmune conditions. And more research is coming out showing even more diseases being tied to autoimmune. In fact, you know, most people are familiar with diabetes, cancer, lupus, Sjogren's, rheumatoid arthritis. Those are some of the common ones. So, Julie, thanks for writing in. You have Graves. That's what we're talking about right now. So Graves, think of this as a two-pronged problem. Number one, it's a thyroid problem, obviously, right? But secondarily, and this is the point that's often missed, is that it's an immune issue. And if you don't ever address the immune issue, the symptoms will continue to persist. And what does that mean? Well, okay, you're going to continue to go to your primary doctor. They're going to send you to the endocrinologist. You get more blood work, and you get bounced back and forth, and eventually end up what I call the medical merry-go-round. It's a state of frustration where you go round and round and round with no answers. And again, you deserve answers. So know that it's an autoimmune condition. That does not mean that you can't do anything about it. And I'm not sitting here and saying that there's a cure and I have it and, you know, nobody else does. Not at all. But think of any autoimmune condition as a dimmer switch. You know, when you're being expressed as far as symptom-wise, it can be caused from food problems. It can be caused from environmental toxins and things like that. Think of that dimmer switch being on high. Now, what you can do is you can manage a lot of the symptoms and bring that dimmer switch down, but you have to realize there's a genetic component of that. So anybody that tells you that, yeah, I can cure your Hashimoto's, I can cure your Graves' disease, run fast and, you know, go seek some other you know, answers, because that's farthest from the truth. And, you know, I will never tell you that. So with Graves, you have to address the triggers to it. The most common triggers that I see in conditions, autoimmune conditions, Graves, Hashimoto's included, are food sensitivities and past exposure to chemicals, toxins, past infections. This does not have to be from things that just happened in the past, like a year ago, 6 months ago. This can be from 20 years ago, 30 years ago. And a lot of people don't put the two and two together because, you know, because it happened so long ago. And so I don't blame you for that. Who would put them together? So food sensitivities, how do you address that? You don't want to guess at that. There's tests that you can run, and there's some technology that I developed several years back called the DNA U-print, which helps you get to the root cause of the problem rather than just addressing symptoms and driving yourself crazy trying to address them all. Because it's just a Band-Aid approach. And if that's what you're looking for, that's great, but you know, I can tell you from a lot of the women that I speak with, they don't know what else to do. And it becomes frustrating because a lot of you that I speak with over the telephone from all over the country, you're doing some great things on your own. You're working out, you're watching what you eat, and yet you still don't feel any different. And I totally understand, you know, where you feel, how you feel, I should say.